Hey everybody, it's Dr. David. Hope you're doing well. Wanted to bring you a Berger bite. As some of you know, last summer we went through some health issues with our dad having a stroke, and as I had announced a few weeks ago that mom has ovarian cancer, had her tumor was removed complete. That's good. She's gonna be starting chemo on Wednesday, and so I just wanted to kind of put out there just in terms of some of the feelings and the things that we are going through. Of course, I know we've already been offered and served up just such wonderful love and prayer and thoughts from the community, and of course we would ask to share as much of that in the direction of Boynton Beach, Florida. As I'll be going down there and staying with my parents through the weekend, and then my sister Shari, who many of you have seen, will be down there later in the week, and we'll be there for a couple months as the chemo goes through. But we're optimistic. It's one infusion. It's going to be a cocktail of a couple different treatments, but one infusion every 3 weeks for 6 doses. So if all is right, it will end in May. And then it takes a couple months, we were told, to kind of a few months to get energy levels back, which is supposed to kind of get a little bit more significant as it goes through, but she's supposed to be able to get it back. And so we're good to know that this isn't we've been told this isn't like the harsh kind of chemo, even in terms of the type of nausea and such. So, there's things that we're watching for and everything like that, but, hopefully good energies, different people get different side effects. And so hopefully for everything that she's been doing and getting herself in a good frame of mind as much as one can have, and taking the supplements and the things that we're going to be helping her do, we've created a protocol of, there's certain supplements, basic stuff that she'll be able to take throughout the course of these next few months, but then certain things which we know that are super important for cellular recovery, like glutathione and curcumin and the CoQ10s and thing, are things that we don't necessarily want or know for sure how it is if it's done at the same time of the chemo. And so we're going to be pulling back from a few days before the chemo to about a week afterwards, so that way we can kind of hopefully get a lot of cellular restoration back, but at the same time not be interfering with the chemo. So hopefully that'll work. I've done that with other patients as well. So the next patient up is Mom. Mom, I know you're watching this too. Just wanted to send you a big love. There's a lot of people out there who are cheering for you. Many of them you never know, many of them you'll never know. But just to let you know that our holistic community, we rise for each other, and our family, everybody's here for you, and for Dad. Hi, Dad, too. But yeah, just really wanted to share with everybody what's going on. We've shared so much of our lives. Many of you have shared so much of your life, and I know so much about you. And, obviously, we're all about transparency and sharing and recognizing that when there's a community involved, that so much more can be accomplished. So everyone, thank you for all your well wishes, and I'm sure I'll give you some update in the not too distant future. Have a nice day.